Our next topic is myasthenia gravis. Myasthenia gravis is an autoimmune disorder affecting the neuromuscular transmission of impulses in the voluntary muscles of the body. It is characterized by the presence of acetylcholine receptor antibodies, which interferes with the transmission of nerve impulses. It leads to muscle weakness and fatigue that increases with exertion and improves with rest initially, and eventually it leads to fatigue without relief from rest. More women than men are affected. Clinical manifestations include ocular muscle involvement in 80% of the patients initially, diplopia including diplopia, that's double vision, ptosis or drooping of the eyelids, weakness of muscles of the face and throat, resulting in a blind facial expressions, generalized weakness, dysphonia or voice impairment, dysphagia causing risk for choking and aspiration, weakness of the intercostal muscles resulting in decreased vital capacity and respiratory failure. And myasthenia gravis is purely a motor disorder with no effect on the sensation or coordination, muscle coordination. As shown in the figure, in myasthenia gravis, antibodies are directed at the acetylcholine receptor sites, which impair the transmission of impulses across the neuromuscular junction. Therefore, fewer receptors are available for stimulation, resulting in voluntary muscle weakness that escalates with continued activity. Of the people with myasthenia gravis, 75% of them have either thymic hyperplasia or thymus tumor of the thymus gland, and is believed to be the site of the antibody production. Diagnostic tests. Tensilin test is the acetylcholinesterase inhibitor test. In this, administer hydrophonium chloride or tensilin IV 30 seconds after the injection. Facial muscle weakness and ptosis should resolve for about 5 minutes. Immediate improvement of muscle strength after administration of tensilin represents a positive test and usually confirms the diagnosis of myasthenia gravis. Atropine should be available for bradycardia, for possible bradycardia, asystole, bronchoconstriction, sweating, and cramping. ICE test is indicated for those with cardiac conditions or asthma. Ice pack is placed over the patient's eye for 1 minute, and ptosis should temporarily resolve in a patient with myasthenia gravis. EMG. This detects, or electromyography, detects delay or failure of the neuromuscular transmission, and about 99%, it is 99% sensitive in confirming the diagnosis. MRI scan shows an enlarged thymus gland. The management of myasthenia gravis is directed at improving the function and reducing and removing circulating acetylcholine antibodies. Pharmacological therapy includes anticholinesterase medications like pyridostigmine or mestinon, which is a first line of therapy. It inhibits the breakdown of acetylcholine and increases the relative concentration of the available acetylcholine at the neuromuscular junction. Adverse effects of mestinon include diarrhea, abdominal cramps, and excessive salivation. Immunosuppressive therapy. This includes treatment with prednisone. Intravenous immunoglobulins. This is used to treat exacerbations and is typically given once in 28 days. Adverse effects include headache, migraine exacerbation, aseptic meningitis, and flu-like symptoms. Plasmapheresis is also used in treating myasthenia gravis. The patient's plasma and plasma components are removed through a centrally placed large-bore double-lumen catheter. Blood cells and the antibody-containing plasma are separated and removed, after which the cells and a plasma substitute are reinfused. Thymectomy. Thymectomy is a surgical removal of the entire thymus gland to prevent production of the antibodies. Myasthenic crisis versus cholinergic crisis. Myasthenic crisis symptoms is attributed to disease worsening. It is associated with under-medication. Increase in myasthenia gravis symptoms occurs, especially more difficulty swallowing, diplopia, ptosis, and dyspnea. Cholinergic crisis is attributed to anticholinesterase medication overdose, and this results in diaphoresis, diarrhea, fasciculations, cramps, marked worsening of symptoms resulting from over-medication. Myasthenic crisis is associated with a positive edrophonium test and a cholinergic crisis with a negative edrophonium test. In clients with myasthenia gravis, be alert for changes in respiratory status. The most severe involvement may result in respiratory failure. Management of myasthenic crisis. Educate the patients in the signs and symptoms of myasthenic crisis and cholinergic crisis. Ensure adequate ventilation. Intubation and mechanical ventilation may be needed. Teach patients to avoid exposure to infections, especially respiratory infections. Bed rest often relieves symptoms. Assessment and supportive measures are used. Measures to ensure airway and respiratory support, including teaching patients effective coughing, use of the incentive spirometry, or IS, have oral section available, and intubate if necessary. ABGs, serum electrolytes, isonos, and daily weights are done. Aspiration precautions are instituted. Sitting up to eat, tucking the chin while swallowing, cut the food to bite-sized pieces, soft solids, nectar, thick fluids, and small frequent feeds. Schedule medications 30 to 45 minutes before eating for peak muscle strength while eating. If patient cannot swallow, nasogastric feeding may be required. Teach patients to avoid extremes of temperature, emotional stress, drugs that exacerbate symptoms like alcohol, sedatives, and tranquilizers. Schedule nursing activities to conserve energy. Plan major activities early in the day and schedule activities during peak medication effect. Provide eye care. Instill artificial tears. Use a patch over one eye for double vision. Sunglasses to protect the eye from bright lights. Tape the eyelids for short intervals to prevent corneal damage. Patients wearing eyeglasses can have crutches attached to help lift the eyelids. Promote a positive body image and coping skills. Encourage participation in treatment plans. Actively listen to patient and encourage expression of feelings. Reinforce progress and explain all care. Encourage medic alert bracelet, alternative methods of communication if necessary. Wiggle fingers for yes or no, use of flashcards, etc.